My name is Kim Price, and I'm a physical therapist that works for CORA Rehabilitation in Sebring. I want to talk to you today about how physical therapy can help treat urinary leakage. I know sometimes it's hard to talk about leaking urine, and it's even harder sometimes to talk to your medical professional about it. But I'd like to walk you through some things that you can do in the privacy of your own home to help urinary leakage. It does work. I've been doing physical therapy for urinary leakage for over 20 years. And in my practice, I have seen myriads of people leave out of the office leak-free or significantly reducing their leakage just by doing some of these very basic pelvic floor strengthening exercises. There's two types of urinary leakage. One is called stress incontinence, and that is where you leak urine when you cough, you sneeze, you laugh. The other most common urinary leakage issue is called urge incontinence, and that is when you leak urine when you feel a strong urge to go to the bathroom and feel like you have to race, and in the process of getting to the bathroom you start to leak urine. Both of these incontinence issues can be treated with physical therapy, and so I want to share a few of these techniques with you. Let's first take a look at some anatomy. I feel like if you understand kind of why are you leaking urine potentially, it's easier to help solve the issue. So on my computer screen here, I hope that you can see this, is a picture of a body cut in half. You will see here that there is the bladder, we have the uterus, and then you have the colon and rectal area. This dome looking thing here is called your pelvic floor muscles, and it is a grouping of muscles just like your arm and your leg muscles. We can actually make that muscle contract, and we can make that muscle relax. So you can see that if that muscle is strong, it can create a pinch on the tube called the urethra that exits the body. When that muscle squeezes, it pinches on that tube and creates a good seal, preventing leakage. If that muscle is not strong enough, then it's not going to create a good enough seal, and you will potentially leak urine. So strengthening this pelvic floor muscle is one of the first things that we try to do with physical therapy, because we need to build the strength back up. So how do we strengthen the pelvic floor? First, how do we contract that pelvic floor? So the pelvic floor tightens when you don't want to pass gas and you're in a public place. It's the muscle that you squeeze down there when you don't want to leak urine and you're trying not to leak urine, and you kind of squeeze down in there in your bottom area. You should feel it kind of vaginally. You'll also feel it rectally. It should be in the area that you're sitting on. You don't want to feel your bottom muscles squeeze together. You don't want to feel your tummy muscles getting tight. It should truly be an internal contraction where it feels like it's lifting up inside you. When you contract it, it's like an elevator that's rising up. It should not be painful. You should not feel like you're pushing or bearing down. Again, it's a lifting up. Once you are able to feel that contraction, then that is what you want to do to strengthen it. Research says that you need to do between 40 and 80 contractions of that muscle a day in order to make progress. If you don't do at least 40 in a day, it's not enough to get the job done. If you do more than 80, sometimes that can tire the muscle out too much, and you're not able to do your normal functions of controlling your urine, and you may leak more if you do more than 80. So I found that range of 40 to 80 works really well. You want to start off by tightening that muscle and trying to hold for 2 seconds. So let's try it together. Let's go ahead and tighten and hold 1, 2, and let it go. 1, 2, 3. So it's a 2-second contraction and it's a 3-second relaxation. And you can try to do that 10 times. That's going to help to work the coordination of the muscle and the ability of that muscle to react quickly and strongly when you need it to be there for you so you don't leak urine. The next type of contraction you can do is more of an endurance contraction, where you're going to tighten that muscle and you're going to try to hold for, say, 5, and if you can, 10 seconds. So let's try that together. I want you to go ahead and tighten and hold. 1, 2, 3, 4, 5. Let it go. When you relax, you want to completely let that muscle go. Completely let it relax. Don't hold back a little contraction anticipating the next contraction, because that muscle needs to rest in order to get prepared for the next contraction. Now, if you found that when you try to hold it for 5 seconds, that you couldn't really feel it relax or let go, meaning that maybe during that 5-second hold, you had already relaxed. The muscle wasn't strong enough to hold it for 5 seconds. That's okay. Then you'll need to start off maybe just with those 2-second holds. And then once you can do 10 of them, then try a 3-second hold, then a 4-second hold, and then gradually work yourself up to a 10-second hold. That's our ultimate goal. So we want to be able to hold for 10 seconds, rest for 10 seconds, and repeat that 10 times. So if we do the quick contractions, the 2-second holds, 10 of them, and we do the 10-second holds, 10 of them, we have a total of 20 contractions. So if you do that set one more time during the day, you'll have your minimum of 40 contractions. Honestly, I'd like to see you do a little more than 40, maybe closer to that 60 or 80 amount. But when you're first starting off, shoot for the 40 and see if you can do it. So that is one way to help strengthen your pelvic floor. You can do these exercises laying down in your bed. You can do them sitting in a chair, and you can also do them in standing. Standing is the most effective position if you can feel that pelvic floor tightening. Sometimes in standing, the weight of gravity on the pelvic floor is too heavy, that it just can't lift itself when you're contracting and standing. That means that the muscle's too weak. You'll have to do the exercises in sitting or in laying down. But if you can, try a few, or if you can all 10 in standing, you're going to get a bit bigger bang for your effort if you can do them in the standing position. So those are some ways to help strengthen the pelvic floor. I also want to talk with you today about ways of helping maybe reduce some of those strong urges that you are having that's causing you to leak. So strengthening the pelvic floor is going to help to control the leakage when you cough, when you sneeze, when you laugh. But now your body is racing you to the bathroom and you're not able to hold it long enough to get there. There are different foods and drinks that you can consume that can irritate your bladder, making your leakage and urgency worse. So some of those foods and drinks are, and I'm sorry, I may be picking on some good things here, coffees and teas, even if they're decaffeinated, carbonated beverages, alcoholic beverages, citrus juices, orange juice, grapefruit juice, sometimes tomatoes, spicy foods, chocolate, artificial sweeteners. These foods tend to be acidic, and that acidity tickles the bladder lining or irritates that bladder, causing it to contract more often and causing it to contract more strong than what we need it to. So I've had some patients come in, and after a week of kind of eliminating those bladder irritants from their diet, their leakage is 50 to 75% better just by altering their diet. So it can be a pretty immediate fix sometimes for leakage issues. So if you wouldn't mind holding off on some of those bladder irritants for the next couple of days, see how your leakage is. If the leakage is better, then you know that maybe some of those things are irritating and causing this problem to be worse. So that's one way to help with the urgency. The second thing that can help with the urgency is called an urge suppression technique. And an urge suppression technique, basically we use your pelvic floor to tighten and to send a signal to the bladder muscle to relax. So let's back this up a little bit. You're feeling an urge. Your normal inclination is just to jump up out of the chair and race to the bathroom. What I'd like to ask you to try is when you feel that urge, I want you to try to remain calm. I want you to sit down if you can, and I want you to mentally think about something else. I know it sounds crazy because all you want to do is get to that bathroom, but if you continue to race to the bathroom, all you're doing is encouraging the bladder to do it to you again. I like to call this bladder an unruly child. It's pitching a temper tantrum inside you, and every time you race to the bathroom, you're kind of giving in to that temper tantrum. So I'm going to teach you how to basically tell that bladder no, that you are now in control of it. It is not in control of you, and that you can actually help to suppress or reduce these urges. So you've felt that urge, you've held off and racing to the bathroom, you've remained calm, you've taken some deep breaths, you've started thinking about something else. And then I want you to immediately start to contract your pelvic floor quickly and strongly 10 times. Tighten, release, tighten, release, tighten, release. With every contraction of your pelvic floor, it is sending signals via a nerve to your bladder, telling that bladder muscle to relax. When that bladder muscle relaxes, that urge goes away. You will be able to feel more comfortable now getting up and walking to the bathroom. Now you want to do those quick contractions about 10 times. Mentally, thinking about something else. Physically, staying calm and relaxed. And you will be amazed that you will feel that urge go away. Start to proceed to the bathroom. Now, more than likely, just like that unruly child, you tell that child no, but then he's going to kind of come back and start doing that same behavior again. That bladder may do the same thing on your way to the bathroom. It may start to send you that urge again. No problem. Remain calm and give it another 10 more contractions. Tell that bladder, no, I'm in control of you. You will be amazed that every time you feel one of those urges, is if you can give it 10 quick contractions, you will start to find that you will be able to regain a little control over these urges. Give it a shot. I think you'll be pleasantly surprised. So I hope today that I've helped to give you some information about how to regain control of this urinary leakage. Regaining control by strengthening your pelvic floor through those quick contractions of 2-second holds and 3-second rests, repeating 10 times. Those endurance contractions where you're trying to hold for up to 10 seconds, resting 10 seconds, and repeating 10 times. Remember, we want to get in about 40 to 80 contractions in the day. Remember, there are some different foods and drinks that can irritate your bladder, making your urgency and your frequency worse. So maybe try to adjust some of those dietary things. And last but not least, the urge suppression technique, where we tighten that pelvic floor quickly and strongly to help control those urges. I sure hope that this helps. I wish you the best with it. If you have any further questions about pelvic floor therapy here in Sebring, I'll be happy to see you. If you're out of town or out of state, I'm sure there is a local physical therapist that is trained in pelvic floor rehab, and they would be happy to help. Talk to your medical professional. Insurance pays for treatment. Get a prescription for therapy, and let's help get this problem taken care of for you. Until then, take care. Have a great rest of your day. Bye-bye.